Thank you, Chairman Pallone, for holding this very important hearing today. The Medicaid program serves almost 10 million individuals with disabilities, so I'm glad we're taking an opportunity to evaluate possible reforms to improve the care for this population. Additionally, in 2005, Medicaid spent $120 billion on individuals with disabilities, so we must be mindful of the most effective way to administer our resources. For this reason, I've long been a proponent of community-based services in Medicaid. As a part of the Deficit Reduction Act, I supported provisions such as cash and counseling, money follows the person, and home and community-based care services. These programs provide states additional options for providing Medicaid-covered services to beneficiaries. Many believe community-based care is a cost-effective method, which I agree with, which not only can save money but also provides better quality care. As someone who, with my wife, we took in our elderly parents. My mother lost a leg and was in a wheelchair, and we cared for them for 8.5 years in our own home. So I am very well aware of the importance of being able to be care provided in an environment that is considered to be your home. For instance, some states have achieved significant savings by transitioning beneficiaries out of nursing home facilities into community through programs like Money Follows the Person. And we have a very successful program in my hometown called Randy's House, named after the son of a close personal friend of mine who was injured when he was a very small child and has been confined and is able to now live in an independent living environment with assistance. And this is the kind of program that I think we all need to encourage. I've also signed on as a co-sponsor of H.R. 1621, the Community Choice Act, which, as you know, seeks to provide individuals with disabilities increased access to community-based attendance services through the Medicaid program. I look forward to the testimony of our witnesses about some of the benefits of this legislation. We need to continue to pursue reforms which reverse Medicaid's institutional bias that has denied Americans with disability access to care in their homes. I look forward to the testimony of the witnesses today about ways to address this problem and the evaluation of some of the programs that we've already created. I thank all of you for your attendance. Look forward to the testimony of the witnesses. And with that, Mr. Chairman, I yield back.
Thank you, Mr. Deal. Next, we have our Vice Chair, the gentleman from Texas, Mr. Green.
Thank you, Mr. Chairman, for holding the hearing today on the role of Medicaid in Americans. This topic is that many members of our audience have been fighting for many years. I'm happy we're taking this important first step to addressing the challenges individuals with disabilities face when assessing care. Medicaid is the primary way we finance and deliver community-based health and long-term services to needy children and adults with disabilities. Medicaid offers many services that are not typically covered under traditional employer-based or private insurance. For those individuals with disabilities, Medicaid is the only way they can assess the service they need. In some cases, the states have the ability to deliver community-based services to children and individuals with disabilities. We'll hear today that many people prefer community-based services because it offers them the opportunity to remain independent in their own homes. This is an important fact that many of us who are not disabled take for granted. For those individuals, having even a small amount of freedom is priceless. The issue we face with the current Medicaid system with regard to individuals who are disabled is that they are forced to enter institutionalized care for a period of time before they can access community-based services, or they're placed on waiting lists by states for sometimes as many as 10 years. When facing with this daunting choice, many people simply enter institutionalization, which they do not want. As a co-sponsor of the Community Choice Act, I'm glad we're discussing this issue today, but those of us with private and employer-based insurance, is that what we have the ability to choose what type of care we want to receive, whether it's community-based or institutionalized. These folks spend years waiting for the type of care they would like to receive, and most never receive or experience home-based and community care unless they forego treatment, find help to transition to home and community care. On a corollary, I've introduced a bill that's in a related topic. People with disabilities are forced to wait 2 years after they receive a Social Security disability award before they can receive Medicare benefits. Currently, Medicare disability waiting period is is the first one, the second one that these people have to wait for. First, you have to wait months and sometimes years for Social Security to make a determination that you're eligible for disability. Then after that award, you have to wait an additional 24 months. Now, Medicaid is typically the health care provider during that 24 months, but I know we've had this bill, and Senator Bingham and the Senate have had this bill to lower that waiting period, so it could be Medicare and Medicaid that would help people with disabilities. As a result, the 24-month waiting period, an estimated 400,000 Americans with disabilities are uninsured unless they qualify for Medicaid. Many or more are underinsured during a time when the quality health care is most critical. It's hard to understand why we force these individuals who are most in need of treatment to wait for years before they can receive much-needed care under Social Security, Medicare, or Medicaid. Seniors, children, and people with disabilities are the most vulnerable members of our society, and we must work together to find a solution offering those who are disabled the service they need, and at the same time not restricting them to the type of care they do not want or take away their ability to remain productive members of our society. And again, Mr. Chairman, I'm glad you called this hearing. I yield back my time.